Hello friends, welcome back to my channel. In this video, we will see about the lumbar plexus. Lumbar plexus, lies within the psoas major muscle. This is psoas major muscle. The lumbar plexus are located within the psoas major muscle. This lumbar plexus is formed by the ventral rami of L1, L2, L3, L4 nerve roots. The L4 nerve root join with the L5 nerve root and which is involved in the formation of lumbosacral trunk. That is why the L4 nerve root sometimes we can call it as nervus furcalis. Why? Because it is going to join with the L5 nerve root and involves in the sacral plexus. So that is why the L4 nerve root is called as a nervus furcalis. So once again I will repeat. The lumbar plexus is formed by the union of ventral rami of L1, L2, L3 and L4. The L4 nerve root is joined with the L5 and forms the lumbosacral trunk. That is why the L4 nerve root is called as a nervus furcalis. So the lumbar plexus is formed by the union of ventral rami of L1, L2, L3 and L4 nerve root. So this L1, that is the upper 2 or 3 lumbar nerves which lies along the corresponding lumbar sympathetic ganglion. That upper 2 or 3 lumbar nerve receives both gray ramus and white ramus communicants. Whereas the remaining lumbar nerve which receive the gray ramus communicants from the lumbar sympathetic chain. So now we'll see the branches from the nerve roots. So this L1 nerve root, it is divides as a upper larger branch and lower smaller branch. The upper larger branch which gives iliohypogastric nerve and ilioinguinal nerve. And the lower smaller branch is joined with the tip from the L2 nerve root and this going to form the genitofemoral nerve. And each L2, L3 and L4 nerve root now it divides into ventral division and dorsal division. Here the ventral division is given in a green color and the dorsal divisions are given in a blue color. So like that the L2, L3 and L4 ventral division of L2, L3 and L4 joins to form obturator nerve. And dorsal division of L2, L3 and L4 joins to form femoral nerve. And this also again it is another branch it is giving, that is the dorsal branch from L2 and L3 joins to give lateral femoral cutaneous nerve. And sometimes accessory obturator nerve may be arising, that is arises from the ventral division of L3 and L4 nerve root. As I told, a branch from the L4 nerve root joined with the L5 and involves in the formation of lumbosacral trunk. So this is the branches given by the L1 nerve root. So the ventral division of L1 gives iliohypogastric and ilioinguinal nerve, and the ventral division of this L1 and L2 give rise to genitofemoral nerve, and the ventral division of L2, L3 and L4 give rise to obturator nerve, and the ventral division of L3 and L4 joins to give accessory obturator nerve, and the dorsal division of L2, L3 and L4 give rise to femoral nerve. Dorsal division of L2 and L3 forms the lateral femoral cutaneous nerve. So these are the branches which is given by the lumbar plexus. First branch is the iliohypogastric nerve, which is arising from the first lumbar nerve, one of the large branch which lies along the lateral border of the psoas major muscle. This is psoas major muscle and this one is quadratus lumborum. So behind the quadratus lumborum is related. So this is the iliohypogastric nerve. Behind quadratus lumborum is related. Above it is related to the subcostal nerve and artery. Below it is related to the ilioinguinal nerve. This iliohypogastric nerve, first it pierces the aponeurosis of transverse abdominis and it passes between the transverse abdominis and internal oblique muscle. So like that it is going to supply both transverse abdominis and the internal oblique muscle. It is then enters into the iliac crest. When it reaches the iliac crest, it divides into anterior and lateral branch. Lateral branch is going to supply the skin of the gluteal region, and the anterior branch is going to pierce the internal oblique, the fleshy part of the internal oblique abdominis and the aponeurosis of the external oblique and becomes cutaneous. So this is about the iliohypogastric nerve. The next one is ilioinguinal nerve. This is a smaller branch which is arising from the L1 nerve root and it is said as a collateral branch of iliohypogastric nerve. Why? Because it is run parallel to the iliohypogastric. And this also lies along the lateral border of the psoas major muscle. It pierces the transverse abdominis muscle and it is also piercing the internal oblique muscle. So after piercing this internal oblique muscle, it enters into the inguinal canal. When it enters the inguinal canal, it lies in front of the spermatic cord in case of male, and it lies in front of the round ligament of uterus in case of female. After that, it leaves the inguinal canal, and it leaves the inguinal canal and supplies to the upper and medial part of the thigh, root of the penis, and the scrotum in case of male, and mons pubis and labium majus in case of female. So like that the inguinal nerve is supplies to uh, transverse abdominis as well as the internal oblique muscles also. The next one is genitofemoral nerve. So this is genitofemoral nerve which is formed by the union of ventral rami of L1 and L2 lumbar nerve. So this nerve pierces the psoas major muscle and the psoas fascia, and it lies behind the ureter and it passes just above the inguinal ligament. It is divides into genital branch and femoral branch. Above the inguinal ligament, it divides into genital branch and femoral branch. This genital branch which lies in front of the external iliac artery, it lies in front of the external iliac artery and supplies to the cremaster muscle and the skin of the scrotum in case of male. In case of female, it supplies to the round ligament of uterus and supply the skin of the mons pubis and labium majus. The next one is the femoral branch. This femoral branch, it lies along the lateral side, just anterolateral to this external iliac artery, lateral side of the iliac artery, and it passes beneath the inguinal ligament. So this is the inguinal ligament which extends from the anterior superior iliac spine to the pubic symphysis. It passes beneath the inguinal ligament and lies anterolateral to the femoral artery. Finally, the femoral branch pierces the anterior wall of the femoral sheath and supplies to the upper anterior part of the thigh. That is the front of the thigh, upper part of the front of the thigh. It supplies. Now, the lateral cutaneous nerve of thigh. It is formed by the union of this dorsal division of L2 and L3. And this lateral cutaneous nerve of thigh which comes out along the lateral border of the psoas major muscle and it lies over the iliac fossa. Here it lies in front of the iliacus muscle. It is then enter into the lateral aspect of the thigh behind the inguinal ligament. Behind the inguinal ligament and it lies along the lateral end of the inguinal ligament. So through the leaving of this inguinal ligament, here it is also crossing between the anterior superior iliac spine and anterior inferior iliac spine. Then it comes out, it supplies to the lateral aspect of the thigh region. Then obturator nerve. It is formed by the ventral division of L2, L3 and L4 joints to give obturator nerve. This nerve lies along the medial, that is, it comes out along the medial border of the that is psoas major muscle, and it also crosses the lumbosacral triangle, and it lies along the anterolateral angle of the anterolateral part of the alley of the sacrum. Then it is enters into the obturator canal. Here it lies behind the inguinal ligament. After comes out through the obturator canal, it gives a branch to the three, that is the medial compartment of the thigh muscle, that is adductor longus, adductor magnus, that is adductor magnus and adductor brevis, and obturator externus and gracilis. The next one is accessory obturator nerve. Sometimes the accessory obturator nerve is present. It is arising from the ventral division of L3 and L4 joints to give the accessory obturator nerve. This also lies along the medial border of the psoas major muscle. It crosses the superior ramus of the that is pecten pubis, and then it is supplies to the pectineus. And this one, it also gives accessory obturator nerve, also gives a tweak to the hip joint. Obturator nerve is the one, it is also giving a branch to the pectineus. Obturator nerve, it is giving nerve to pectineus, that is pectineus muscles also supplied by the obturator nerve. Then the next one is femoral nerve. Femoral nerve is the largest nerve of the lumbar plexus. It is formed by the union of dorsal branch of L2, L3 and L4 joints to form the femoral nerve. This lies deep to the psoas major muscle. From the root itself, that is from the root of the femoral nerve itself, it is giving a branch to the iliacus. It is giving a branch to iliacus, and a branch is going to give to the pectineus muscle, and it gives a vascular branch to the upper part of the femoral artery. So once leaving the inguinal ligament, it is giving a branch. It is divides as a anterior and posterior division. The anterior division is going to supply the sartorius muscle, and the posterior division supplies to the quadriceps femoris muscle. Quadriceps femoris means the rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. So these supplied by the femoral nerve. So like this, the nerve roots, branches and its supplies are discussed here, are explained here. I think this video should be helpful to remember about the lumbar plexus clearly. Thank you for watching this video. If you like this video, please share, subscribe and click the bell icon.